Hello! This video will demonstrate proper aseptic technique for use in the microbiology laboratory. Aseptic technique is a method of transferring bacterial cultures when working in the microbiology laboratory. This includes general guidelines as well as specific steps to take when working in the lab. Aseptic technique is necessary for several reasons. To protect yourself from contact with biohazards. To protect your samples from becoming contaminated. To protect others in the lab. Bacteria are everywhere, on the counters, in the air, on the lab bench, on all equipment, even in your hair. In the clinical setting, aseptic technique is important in order to avoid infections, whether they be from patient to staff or from staff to patient. In particular, you want to avoid nosocomial infections. These are infections that are not apparent at the time of hospitalization, but become present during the hospital stay. Such infections are the fourth leading cause of death in the United States. The hospital is a reservoir of pathogens, and some can become antibiotic resistant. Patients often have a compromised immune system because of their illness. Nosocomial infections can be transmitted from patient to staff, from staff to patient, and from patient to other patients. Proper aseptic technique in the clinical setting helps eliminate the possibility of spreading nosocomial infections. Before demonstrating aseptic technique, it is important to review some terminology.
A medium is something in which microorganisms grow.
A sterile medium is a medium that is free of all life forms. A culture is a sample of microorganisms growing in a medium. A pure culture is a culture that only has one type of microorganism growing in it. A mixed culture is one that has two or more types of microorganisms growing in it.
An autoclave is a steam sterilizer consisting of a metal chamber that can withstand extremely high pressures. The pressure is elevated high enough to raise the temperature of steam so that it can sterilize equipment. Contamination is the introduction of microorganisms to sterile articles, materials, or tissues, or the addition of unwanted microorganisms into cultures. A disinfectant is an agent that is intended to kill or remove microorganisms. It does not remove bacterial spores.
A pathogenic species is one that can cause disease. A sterile substance is one that is free of all life forms. Sterilization is the process that is used to remove all life forms. An inoculum is when you transfer a sample of a bacterial culture from one sample to another. Some general laboratory guidelines are important to review.
Always disinfect your lab area with 10% bleach before and after working. Do not trust that the person before you thoroughly cleaned the bench, and leave it disinfected for the next person.
Keep doors and windows in the lab area closed to avoid contamination of microorganisms spread by air currents.
If a spill occurs, clean the area thoroughly with 10% bleach.
Bring only the things needed for the lab procedure into your lab area.
Discard biohazards appropriately in a biohazard container to be autoclaved when full.
Always treat your sample as a potential biohazard, even if it is not. Do not talk, whistle, cough, or sneeze in the direction of your sample, as it will become contaminated as well. Never eat or drink in the lab area. Do not lay sterilized equipment on the lab bench, as it will become contaminated. Finally, always tie long hair back, as it can also be a source of contamination.